today in global health, which is starting, and the idea is to bring you up to speed on what's happening in the world of health, how experts are deliberating, the deliberations that go on, the decisions that are made, the policy, funding opportunities, what to look out for, how to, everything that has to do with global health. Because we are now in a global village, and whatever happens in Nigeria is not really restricted to Nigeria. For all you know, it didn't even start from Nigeria. So we're getting into that conversation today. And how do we discuss global health and start local? Trust Lagos Talks. We go to the end of the world to bring you experts that will be having these discussions with us. And now, just to run this through by you, on every episode, we're doing this in collaboration with one of our own, one of the brightest experts we have from Nigeria, and that is in the person of Dr. Uchechukwu Ngwaba. He will be joining this program every Tuesday, and we're working around making sure that you're brought up to speed on events concerning global health that happens. As it happens. So before we even get into the conversation today, let me bring to the mic Dr. Uche Ngwaba, who is joining me all the way from Toronto. I hope I pronounce it like you will do over there. Here we'll call it Toronto. But joining us all the way from Toronto Metropolitan University in Canada, Dr. or Professor Ngwaba. Good morning to you.
Good morning. I'm glad to be here. Thank you,
Yeah,
Karen.
great to have you join us this time as well. And we're excited that you're here. Great. And thank you for joining us. We also have joining us this morning also from, outside Nigeria. Let's put it that way for now. We have Rachel Dunn, who is joining us this morning to have a conversation around global health. Hi, Rachel. Good morning to you.
Morning. How are you doing?
Not bad at all, Rachel. Thank you for making our time with us this morning as well.
Yeah, absolutely. Very excited to be here.
Yeah. Welcome to Nigeria once again.
Thank you. I appreciate the warm welcome.
Great. So let's start a conversation this way, Dr. Ngwaba. This is the first edition of this program, and the whole idea is to bring Nigerians up to speed on the world of health, global health, as it does happen. But the question is, what is global health? Why do I need to be in any way concerned about global health? So you want to take us through what really global health is?
Thank you very much. So this is a very important question, one that is often overlooked when we talk about global health situations. Many will think that global health will suggest diseases or health crises that are taking place in, the poor parts of the world, or as we call it in the literature, the global south, Nigeria being a country in the global south. And so many would think that only health crises that happen in places like Nigeria and other parts of the global south will qualify as global health issues. But then I think that in trying to understand global health, we should try to understand what it tries to do. Global health aims to observe, it aims to document, it aims to monitor, and it aims to interpret and eliminate the harms that arise from national and transnational forces that are harmful to health, whether they are political, whether they are commercial, whether they are military, whether they are financial, whether they are diplomatic, whether they are legal, intersectional, and cultural. So you can see that by this very expansive approach of looking at global health, you can see that pretty much anything and everything can qualify as a global health crisis. If, for example, a state government in Nigeria decides to go and demolish houses in a particular community without providing very good alternative housing situation, and individuals are left on the streets without anything to fend for them, that's a global health crisis. You can see, because that's a political decision that has been taken by the government, but then it has affected what we call a determinant of health. Housing is a determinant of health. So when we begin to sort of interpret global health with such an expansive lens, you can see that everything the government does within our local population, everything the government does interacting with other external forces, for example, international corporations who come into Nigeria and who, undertake trade practices that are not necessarily beneficial to the Nigerian economy, and therefore it harms the ability or livelihood of individuals in the community. Say, for example, importing substandard products, which are then sort of circulating in the public, and individuals are consuming those substandard products. That's a global health problem, because you see that consumption of a substandard product can have implications for the health and livelihood of the population. So, in other words, global health it goes beyond just an epidemic like COVID-19, or a pandemic like COVID-19, or an epidemic like Ebola. Global health, it covers a whole a constellation of factors and circumstances that can affect the abilities of individuals within the population to be able to live a healthy life.
And I guess because if you're not able to live a healthy life in your space, if you might one way or the other, seeing how much of a global world we live in, that might in one way or the other affect other parts of the world. You might just transport whatever you're going through to other parts of the world. That's it.
Absolutely.
And now, having said that, that is the voice of Dr. Ngwaba there. He's not one that you just, asked to just give a brief intro. He breaks everything down, and that's what he's just done now. But before he goes into further explanation, let me just tell you a bit about him. For those who've been on Lagos Talks, you would know him because he featured on a Health Month. And I'm sure a lot of you are saying, yeah, so he's the one. So Dr. Uchechukwu Ngwaba commenced his academic career as a research fellow at the Nigerian Institute of Advanced Legal Studies in 2010, subsequently proceeding to Sydney, Australia, to undertake his doctoral studies. His doctoral research utilized a comparative method to explore how human rights framework can strengthen Nigeria's health system to achieve universal health coverage. Now, before taking up his current appointment as an assistant professor at the Lincoln Alexandra School of Law in Toronto Metropolitan University, Canada, Dr. Ngwaba taught as a sessional lecturer in 3 Australian universities for about 5 years, and that is the Macquarie University in Sydney, Deakin University in Melbourne, and University of Western Sydney. Dr. Ngwaba's scholarship engages multidisciplinary, comparative, and socio-legal methods in exploring complex questions affecting health governance framework in global North and South. His works engage extensively with health regulatory systems. He engages critical human rights perspectives and post-colonial theory to examine how health governance and regulatory systems impact health outcomes in global North and South. Now, Dr. Ngwaba currently leads a program of research focused on advancing a regional health governance approach in the Inter-American system. And that is the man you just heard right now. Now, before I go to our next guest, let me tell you who Rachel Dunn is. She holds an undergraduate degree in political science and French, bonjour, and along with a postgraduate certification in international development. She brings experience from both the nonprofit and legal sectors. With a strong interest in global equity and justice, Rachel recently earned her law degree from the Lincoln Alexander School of Law and will soon begin articling with the Department of Justice. In her spare time, Rachel is a foodie, that's very healthy, who enjoys spending quality time with family and friends. So those are the guests we have for you today. Do get ready to have a great time. Now, so you've just said now, Dr. Ngwaba, that global health does not necessarily need to originate from outside your territory. What you do as well affects global health. Now, let's stay with you before we then go to Rachel after this. Now, so with how important or what kind of attention should, okay, this will be a two-pronged question. What kind of attention should Nigeria pay to global health? And which cautions should Nigerians take as well in, in negatively affecting or influencing global health?
Okay, that's a very important question, Kayode. First, what attention should Nigeria pay to global health? I would say that one of the fundamental responsibilities of the government is to strengthen the capabilities of the Nigerian public, the Nigerian population, to be able to achieve the right to health. And so, for that very simple reason, Nigerians and the Nigerian state should pay a lot of attention to essentially their understanding and their practice of, global health as we understand it. And so, obviously, based on my earlier comments, one of the things you quickly realize is that there's an entire value chain that comes together to form or formulate what we understand as global health. And in saying so, a key point I'm trying to sort of put across is the fact that global health is not just what happens in the hospital. Global health is not just what happens when there's a pandemic or an epidemic or there's a health crisis. Nigeria, for example, has struggled for a very long time with a number of diseases that have sort of health with. For example, Lassa fever at one point in time was a big deal, and there were all kinds of public awareness campaign about Lassa fever and all of that. Now, yes, those public awareness campaigns are important. Those are issues of that impact the health and well-being of Nigerians. But that alone is not what needs to be done. Like, we need to take action even before there is a health crisis. What is the nature of our built environment? Are we living in an environment that is healthy? Or are we living in an environment that is prone to, practices that, that are unhealthy? For example, dumping of refuse all over the place, living in an area where there is no proper sort of planning or arrangements. What about our access to food sources, for example? Is the average Nigerian able to sort of have a very sort of balanced meal? All of these concerns might seem very unrelated, but actually they have significant implications for global health, because you see, global health is tied to this idea of equity. It's about health equity. The way that a wealthy Nigerian or a middle class or upper class Nigerian can be able to have access to all of the necessary conditions to be able to be healthy in life. The average well-to-do Nigerian lives in a neighborhood where they can exercise, they can run around, they can do things to keep fit. But then if you flip the script and look at what those in the lower class or the lower echelon of the economic ladder are doing, you see that they don't have the same opportunities to have access to the same kind of circumstances. Now, our position is that these are issues that are of concern to global health. In other words, global health doesn't have to start from like external places. It doesn't have to be out. It doesn't have to come from like external
Outside
causes.
your region, yes.
Exactly. It could be within your community. There could be a global health crisis happening in a Morocco community. There could be a global health crisis happening in Ipaja or anywhere at all. It's about whether or not we are paying attention to all of we call them determinants of health, all of the things that have the implication or the ability to determine whether or not individuals are able to be healthy or unhealthy. So that's why we should pay attention to global health. Global health is about governance. It's about how we govern our society. It's tied to good governance. By paying attention to global health, we will invariably be paying attention to all of the things that would bring about good governance in our society. Now, what are the things? The second part of the question was about the negative factors that we should also pay attention to. Yes, you mentioned the point in your earlier question about the transnational implications of global health crisis, which is to say that something that originates from Nigeria can very quickly, be found, be transmitted to a different territory altogether. Many of us are all sort of, we all recall how Ebola came into Nigeria. I don't know if you guys remember the story.
A Liberian.
The Liberian name, I still remember his name, Patrick Sawyer.
Oh, yeah. Patrick Sawyer, that's it.
He came on a flight from I think Liberia to Nigeria, and it took you of course you remember that valiant heroic doctor who
Stella Adedabo. Yeah.
exactly who paid with her life. It
Mm.
was the singular effort of Dr. Stella Adedavo, may she rest in peace, who took very prompt action to contain him and say you cannot go anywhere. It doesn't matter what excuses you give. You are not going to leave this place. So you can see that um, as a country, we also need to be very careful in terms of our health surveillance infrastructure and system. One of the things that really stood out, and I think that was a significant moment of global health, a public health triumph for Nigeria, was that when the Ebola epidemic situation was playing out, the health authorities were able to track and trace individuals that came on that flight and were able to quickly quarantine them, isolate them from the population. That was, I mean, you can say so many things about what is wrong with the Nigerian health system, but that is not one of them. That was a fantastic
That's commendable.
accomplishment. So in other words, that goes to illustrate my point about what we should be doing as a country or what we should avoid doing. We should avoid being a source of, transmission or exporting global health diseases from our borders, because when we do so, we are, in other words, burdening the global health community, in the international community, because not many health systems have the capability of surveillance that our health system has.
All right. And it's good to say that, but let's backtrack a bit. When we talk global health, so the average Nigerian who is listening for the first time, you'll be wondering, what is the origin of this? How did we get here? Why the words global health? What does it mean? Were there events that happened at that time? And maybe if you can get a bit of clarity on that. I don't know if Rachel can address that for us, and not in French, but in English, so that...
I can do it in both if you'd like.
In both? No, English is okay for now.
I'm just teasing.
Yeah.
Yes, so when we're talking about the origin story of global health, it's very interesting because there's different academic and historical approaches to this question. And some historians actually would say that it was the HIV or the AIDS epidemic that invented and started global health. But other historians that I know, Professor Ngwaba, having taught me, would say this, there's a danger in assigning a single disease as the point of origin of global health. And the reason why is that it completely ignores that historical, political, those economic forces that have shaped global health, and it centers a Western narrative. It says that global attention was only brought to these diseases when it affected the global north. So we shift away from kind of an origin story as a point of single disease because we know that global health isn't just about illness. It's about equity, it's about prevention, it's about ongoing initiatives. And so Professor Ngwaba already shared the quote about global health seeking to observe and monitor and eliminate harms. But we can also say that it's about power, it's about poverty, violence, exploitation, oppression, silence, collusion, exclusion, right? And if we kind of examine global health using this broader lens, we have to kind of look at the origin point of these harms to global health, which is colonialism.
All right,
So when
now,
we talk,
okay, go ahead.
no, please.
All right. Now, hearing you speak about global health, and that is both you and Professor Ngwaba, hearing you speak about it feels more like human rights advocacy because it covers so many things. But if you look at this now, let's just get maybe a bit more clarity. Being the first episode, we just want to understand as much as we can what global health really means. So when you look at, we've heard of international health, we've heard of global health, we've heard of community health, and all what you've said, it seems to play a role, you can apportion different parts of what you said to any of these three health descriptions, maybe international, global, or community. So what is the difference so that we don't get it mixed up here?
Okay, let me quickly jump on this question. So it's very interesting because there is a politics and dynamics of power at play in assigning meanings to all of these categories. I have a very good friend who is a very respected senior scholar in Sydney, Australia, Professor Sheye Abimbola. Professor Sheye Abimbola has developed a caricature to describe, all of these stages, or what we call periods of global health, of health, evolution. The first is what he calls Global Health 1.0, which is uh, tropical medicine. I don't know, you may have heard of tropical medicine. There's a London
Yeah.
School of Hygiene and Tropical Medicine. There's one in the Philippines. Tropical medicine, and to layer onto Rachel's earlier point about the origin of global health, where she said it started out as colonialism. Uh, what adds to that point is the fact that, and this is really very important to understand how global health currently is sort of situated. Uh, uh, um, if you recall, many of you may not know this, but from a very sort of historical point of view, um, the WHO, the World Health Organization, started out as a result of the convergence of two institutions, one in the Americas and one in Europe. Um, the OHIP it's a abbreviation, but it's a French name. Essentially, the OHIP was an institution that was set up in Europe. It came out of what we call the sanitary conferences. The sanitary conferences took place, at the turn of the last century, where countries of the world, the Western countries in Europe, were trying to grapple with infectious diseases that were sort of transborder diseases that were affecting trade. And so the sanitary conferences came up with a process for sort of moderating the transmission of this disease so that it does not affect trade. At that point in historical time, when the sanitary conferences were coming up with agreements and conventions or treaties, in the colonial world, that is in Africa and in colonial Asia, tropical medicine was being established. In other words, tropical medicine was a framework that was used to protect the white men and the white civil service operating in the colonies, to protect them so that they could be productive, to protect them from diseases of the tropics. That is the origin of. So when you hear global health, that is the origin story. It's from that moment it emerged. So in other words, even though today there is supposed to be like a convergence of the sanitary conferences, which led to the WHO, and then tropical medicine, which is all part of the framework of the WHO. The point I'm trying to put across here is that when we talk about global health, the politics of the global economic order is such that global health means different things to the global north and to the global south. In the global north, okay, global health means global health security, which is to say, protect the global north from the diseases of the global south.
Oh,
You
okay.
understand? So that is why even today, when we talk about the response to the COVID-19 pandemic, if you listen to the narrative in the global north, it is about global health security. And that was why the first response the US made when they discovered some variant of COVID in some African countries was to ban citizens from those countries coming to the. That was global health security. But then in the global south, okay, it is global south is supposed to be a site of disease. It's supposed to be a site of poverty. And so it is acceptable for people to die in the global south. And that was why when Ebola was happening, if you recall, 2013, 2014, when Ebola was happening and a lot of people were dying,
Yeah.
nobody did anything. The WHO did not step up to do something about it. It was when the first case got on the plane to go to
Was it Spain or where?
Spain, I think.
Yeah, one
And
of them. Yeah.
immediately that happened, the WHO now rose up and said, this is not acceptable, terrible. And then that was when international action happened. So now, to your question, what is the distinction between all of these categories? I went on this tangent to illustrate the fact that there are layers of meanings and power dynamics and political and international politics at play in the framing of these categories. So, coming back to Professor Abimbola's categorization, Global Health 1.0 was tropical medicine. Global Health 2.0 he defined as international health, which was essentially about clever people, in quotes, from the global north or high-income countries, helping low and middle-income countries to overcome their health crisis. And we had a point in time when it was always expatriates coming from Europe and America, coming to the poor countries in Africa and Asia and say they are doing international health. And then Global Health 3.0 is, in this context, smart people or clever people from high-income countries leading health programs in low and middle-income countries. And I'm sure many of us have witnessed this in Nigeria in the context of projects that were being handled by USAID, where they bring in their expert personnel to come and lead those programs of malaria control, female genital mutilation, or all kinds of issues that investing in. They will never give the experts within, this local expert public health practitioners in Nigeria. They will never give them the funding and the liberty to lead these programs. Rather, they will bring their own people to come and lead those programs. And then Global Health 4.0, which is about low and middle income countries leading health programs in low and middle income countries. In other words, Global Health 4.0 is the destination we should be getting to, where Nigerian experts should be leading health situations in Nigeria. But then, unfortunately, we are not yet there. And to illustrate that fact very clearly, if a health expert, if a population health expert or global health expert from Nigeria goes to visit, say, the United States or Canada, they are not experts. They're not regarded as expatriates. But then if even a low-level a public health person from Canada or America comes to Nigeria, they are regarded as expatriates. In other words, expertise only lies with the global north. It doesn't lie with the global south. So those dynamics are very important. When you talk about global health, international health, there are dynamics of power that are at play in those categorizations.
Yeah, and as it is with almost everything we do in that part of the world, when it comes to the dynamics of power, we are always at the receiving end. We are always the weakest link. So when you talk of global health as it stands right now, it's a bit of concern to see how all this plays, because do Nigerian politicians, or let me extend it even beyond Nigeria, African politicians understand the importance of global health, the dynamics around it, what we tend to lose if we're not playing well at the table of global health, and how we could play around this to ensure that we make the best use of global health, probably linking up with we in the global south in Africa with other parts of Asia who are probably in tropical medicine.
Good question. Rachel, this might have been a question I would have loved you to take, but then you're not an expert about what Nigerian politicians are up to. So let me take that question. So, look, this is a very important question you've asked, Kayode. And for someone like me whose work is about it's about health governance system, strengthening health governance system, my doctoral research was about, how do we deepen the right to health in Nigeria? It pains me to say that our leaders have failed us in this area. And I don't think I need to go too far. I think you only just need to look around you in Lagos to see what kind of policies are being sort of rolled out, what kind of safety nets are being put in place, to cushion, the shock of both global and local political and economic situations. And so there is a sense in which the political elites in Nigeria, across the African continent, have not come to terms with their responsibility to strengthen health capabilities of their citizens. Because in all of this discourse about global health, the end point or the end destination is how do we correct those forces of economics, power, politics, and all of that when the when the interplay to produce outcomes that are not ideal for achieving the right to health, and simply the right to health, because that's a very technical term. People, it's not just a neutral term when you say the right to health. The right to health means a very specific thing. It's about availability, accessibility, acceptability, and quality of health goods and services. And so when you say the right to health, you're making you're making a statement that invokes those four elements. We call it triple AQ, and it comes from a definition offered by Article 12 of the International Covenant on Economic, Social, and Cultural Rights, as well as an interpretation of that article by the Committee on Economic, Social, and Cultural Rights, which is the global human rights monitoring body responsible for giving meaning to that treaty. So, in other words, when we talk about what our political elites should be doing, our political elites should be investing in systems, processes, structures that can strengthen determinants of health. And I'm sure Rachel can talk to you about commercial determinants of health and other forms of determinants of health. These are things that have implications on the ability of individuals to live a healthy life.
Mm, All right. Now looking at this, you said earlier on that there is the divide, the definition for global health from the north and the south part of it. But when you look at all that we have in Nigeria as it is right now, if there is any outbreak, you alluded to it earlier, but I just want to be more clarity on this. If there is any outbreak in Nigeria as at today, maybe after COVID-19 and Ebola back to back and all the challenges that came, and how closely knit we've seen that the world is it likely, does it qualify to be classified as a global health challenge, or is it still community health that we're dealing with?
Very interesting question. And the answer is it is not community health, it's global health. But then I think this is a point where I want Rochelle to sort of even speak to, because it also has implications even within a country like Canada, where we have poor communities that can also be sites of global health. Rochelle, is this something you want to jump on?
Yes, absolutely. I think when we're talking about, so we were mentioning before social determinants of health and commercial determinants of health, and I think that's something important to tease out because it tells us that health is more than just a condition, something that you're born with, or a medical element that is outside of your control. There's external factors that contribute to these personal health issues, these national health issues, international health systems. And so if we look at a social determinant of health, that has to do with the conditions in which people are born in, they grow in, they work and live in. And this is actually a definition from the World Health Organization. And it's also the systems that are put in place to deal with illness, and how these systems shape conditions of daily life. Social determinants of health, they include things like economic policies, systems, and it's important to recognize uh, how addressing these social determinants of health not only helps to prevent illness, but also to promote healthy lives and social equity. And then I want to switch to commercial determinants of health because that has to do with commercial actors, their actions, their omissions, um, and even the conditions in which they work that affect health. So we have companies coming and polluting communities. In Africa and the African diaspora, my background is Jamaican. I'm born in Canada. I have Jamaican parents, so I also have a Caribbean perspective, and I can see how these corporations come and oftentimes treat the country that they're in. All of this to say that these definitions are important because they talk about global equity. We have to examine the sources that impact equity. pointing to your question and this idea, if there was a global outbreak in Nigeria, if that's a global health issue, absolutely, because we have to examine how these different actors come together. There's an interesting story that I want to touch on, and it has to do with Mpox. The World Health Organization had declared in 2022 Mpox to be a national emergency. Um, but Africa didn't receive the support that they needed during that time. Uh, and even though the cases in Africa were continuing to rise, and so once the cases in the global north started to decline, then the escalating cases in Africa were largely ignored. And the African Center of Disease Control decided to do something about this. And for the first time ever, they declared Mpox to be a public health emergency. And it sends a powerful message. It sends a message that, we're asserting regional authority and agency, and we don't have to wait for global institutions to act. We can act, and we're also leaders. We're not just recipients of health and aid. It challenges that narrative that health leadership has to come from outside of the continent. Africa is not just a recipient of aid, they are empowered to lead their own health agenda. So if we're having an emergency, a global health outbreak in Nigeria, absolutely, it's a matter of global health, but we also have the ability to, and I'm saying we as a member of the diaspora, I'm including myself in that, we have the ability to address it and make it an issue of importance because it is an issue of global health importance.
Rachel has put it very brilliantly, matter of fact, because your question was, if we have community programs, is that global health? And
Yes.
this example she has given has demonstrated that, in fact, community health programs or community-led programs are indeed global health programs because it is essentially the community taking agency and leading from the ground. And the example she gave about the Mpox situation is also brilliant because that is one of the accomplishments of the Africa CDC in recent times that have said it challenges the power hegemony of the global north to say, we are now beginning to claim agency in Africa, and we're not going to wait for you to declare. And so here's the interesting part, which Russia doesn't mention in that story. When Africa CDC declared Mpox to be a public health emergency of continental security, and that was last year, 2024, they declared it, they say, I'm not very sure on the date, but let's say they declared this on the 13th of August. On the 14th of August, the WHO immediately declared Mpox to be a public health emergency of international concern. The WHO was not going to be outdone by Africa CDC. And for me, it was a sign that if you begin to take agency, the rest of the world will follow you. The
Exactly.
WHO would not have done that if Africa CDC hadn't done it.
Hadn't done that. And that ties into my next question, which I dare say you practically just answered, because I was going to say, based on your definition and your explanation on all what the global health is, that can Africa in a way break away from that understanding and that definition and begin to focus rather than global, focus on continental? But this example of Mpox, I guess, has just answered that indirectly. So it is possible that we could have a new definition that focuses on South as against looking up to North to give us the information and policy and guidance and support that we need.
Absolutely. In fact, you read my bio, and one of the last things you mentioned in my bio was that I am leading a program of research on designing a regional health governance approach for equitable pandemic management in the inter-American system. There's an update to that. I've also expanded that scholarship or that research to the African human rights system. There are over 15 multidisciplinary scholars who are part of that research program. And the program is currently funded by a Social Science and Humanities Research Council grant of the Canadian government. Now, what is that program really all about? That research program is us taking up the gauntlet and saying, we can no longer wait for the global north to call the shots. We need to strengthen capabilities within regional contexts like the African region. The African region needs to develop its own capabilities to identify and take action with respect to epidemics and pandemics. The ability to mobilize resources to manufacture vaccines so that it is not dependent on the World Trade Organization going cap in hand to beg for waivers to the trade-related aspects of intellectual property rights so that they can manufacture cheaper vaccines. It happened during the COVID pandemic, and for a very long time, America and the rest of Europe denied India and South Africa when they were begging for access to, intellectual property rights patents so that they can manufacture COVID vaccines that were cheap and easy to afford. So to your question, it is not just something that is desirable. It is something that we have no other choice but to do it. Everybody's agreed that there's going to be another pandemic. It's not if there will be a pandemic, it is when it's going to happen.
When. It's a certainty.
Exactly. So the question is, what are you doing to address that certainty? Are you going to repeat are you going to repeat the experiences with COVID? And so there are two major initiatives that have taken place in recent times, and I think in subsequent episodes of this program, we're going to talk about them. One of them is the negotiation of a pandemic treaty, and I think that's going to be our next episode. A pandemic treaty has just been negotiated, and last year, the international health regulations were revised. You see, I'm not a very strong believer in those measures, because time and time again, the international community has failed the global South. Time and time again, they have made promises they have not kept. Okay, look at the United States woke up one day and withdrew USAID funding, and it didn't matter that there were a lot of people who were dependent on drugs, supplies, and all of that from that program. There were no alternatives in place. Okay, so how do we prevent those sort of hostage situations? Because I regard it as that was just taking us hostage. How do we prevent that? The only way is by claiming our own agency. We need to begin to design our own systems. My brother, it's like, how do you make sure that rain doesn't beat you? Maybe you have this habit of when the rain is falling, you're living in an open roof house. When rain is falling, you run to your neighbor's house to hide under the rain, hide from the rain. And then one day your neighbor says, you know what? I don't want you to come to my house anymore. Go under the rain. Let rain beat you. So the question then becomes, how do you prevent rain from beating you next time? It's very simple. Build your own house or roof the house.
Or roof the house. Yeah, that's it. If you don't have money for that, just get a canopy or something that protects you while it's raining. Just hide.
Start from somewhere.
That's it. Yeah,
Exactly.
that's it. And what you're saying sounds tenable. It sounds like what we should be doing. But I mean, you're familiar with events in Nigeria. There were talks about countries, and Nigeria in particular also included, there were talks about the risk or the dangers of Nigeria joining BRICS, which means you'll be aligning with Russia and all that, and it means that all the aid you'll be getting from America might be jeopardized. Now, if we say we want to focus on Global South and build our own very strong structure, all what you're saying now, you've referenced research. You're doing this research. You're doing that research. It is being funded. One man that comes to mind when it comes to funding is Aliko Dangote. How much can he do? Do we have enough funding or sources of getting money to fund all this research and begin to implement this? Because if we don't, it means that we'll go back cup in hand to beg and say, we are sorry we attempted to break away.
My brother, you have just hit the heart of the matter. Okay? This is the heart of the matter. You see, look, it's very simple. It's like, sometimes when you get somebody, I don't know if this has happened to you, where maybe you're among a group of friends, there's a particular friend that seems to be very, he seems to be very capable, always thinking deciding everything that everybody should do, the group should do. What happens is that every member of the other members of the group stop thinking for themselves. You just say, oh no, Kayode will do it. Kayode will figure it out. All right, they will stop thinking for themselves. But the moment say Kayode is, for one reason or the other, unable to do it, or says he doesn't want to do it, the group will either be paralyzed or somebody else will take up the initiative. In other words, the reason why our entrepreneurs like the Aliko Dangotes, the Otedolas, and all of the big names and the industrialists and the wealthy people who can do this, the reason why they haven't done it is because obviously we haven't created the need for those sort of interventions. But I assure you that is where we need to be going. We need to, and it's very interesting you ask that question, because you see, one of the points that we need to grapple with in the context of designing our own system is the fact that we need to start putting our money in our system. Okay? Corruption is a big problem in Nigeria. I won't be too upset if when people steal the public funds, they come and invest it in structures in the country rather than going abroad to go and buy properties or investing or leaving it in some Swiss account or some account in those safe haven countries. Assuming you steal money and you go and build like world-class hospital facilities in the country, my brother, we should be applauding you, because at least somebody is going to be able to rely on those hospitals for healthcare. In fact, I would say you should be given an award, because you simply borrowed the money on our behalf to build the institutions, because we can use it. So, in other words, what I'm trying to say is that we need to begin to have a different kind of mindset about how we see our country. Patriotism. Nigerians were only patriotic when it is football or moments. But we are very episodically patriotic. We're not 100% patriotic 24 hours of the day. We need to shift from this episodic patriotism sort of syndrome to a context where we are now sort of 100% patriotic. In other words, as a country, our elites, our philanthropists, our industrialists should begin to fund research in health. University of Lagos has a medical school. Our Lagos State University has a medical school. There are so many medical schools in Nigeria. How many of these schools have significant research grants funded by wealthy Nigerians? How many research chairs have been funded by political elites in Nigeria? Say, set up a research chair on population health in University of Lagos or Lagos State University. We don't see that. That's not common. But that is where we need to go, because you see, here's the interesting thing. I was born as a Nigerian, migrated to Canada, now became a Canadian. The Canadian government doesn't ask, where did you come from? When I apply for a research grant, they look at, can you do the job? Are you competent? And then they give me the grant. We need to get to that stage in Nigeria in terms of
federal character.
Exactly. Like, we need to begin to fund, we need to put money where competence lies.
Yeah.
Dr. Adadevo was able to be a hero. Why? Because she was a competent doctor. Do you understand? If she wasn't competent, millions of Nigerians would have died. Do you understand? So the point is that as a country, we need to begin to have a change in our mindsets. We cannot reap the benefits of a good health system if we are not prepared to invest in our health system. It's as simple as that. And that's the difference between the developed world and the developing world. That's the difference between the global north and the global south. Of course, we can have other conversations about the politics of exploitation, of post-coloniality, where our resources are being stolen by global north countries. We can have those conversations, and maybe that's a conversation.
The conversation is just getting started, so there's still so much we'll get into.
We too, we need to look internally and think about what we need to be doing as a people. I don't think we're doing enough yet.
All right. Okay, go ahead. We're bringing this on.
If I can add to that, when you have a solution that is based on local knowledge and content, it's more sustainable because it is culturally relevant. It's created by the people for the people. A lot of times when you have these international programs and foreign aid, it is rich individuals and corporations saying, we want to create a project in this certain area and launching it. It's not always the most relevant or pertinent issue that needs to be addressed. So when you have local talent, local knowledge, local context coming together to create solutions for the community, it ends up being more sustainable and it ends up being more impactful as well.
All right, and that makes perfect sense. And because they know the places better, they should be more committed to working for their country. And like Professor Ngwaba said, he said we need patriotism, we need to be committed. And when you said that, the only thing that came to mind is don't just wait till your country is doing well, till development is really coming from the federal government, till the government and politicians are playing their role. It is very important they do that, but whether they're doing it or not, you remain patriotic. And for those who don't understand, what Professor Ngwaba is saying is that just be like the average Arsenal fan. No cup, but you're still committed.
You had to bring it. That was a low blow.
I hope you're not an Arsenal fan.
I'm not. I'm a Liverpool fan.
Oh, you're a Liverpool fan. And Rachel, are you an Arsenal fan?
I am supposed to say that I am a Manchester United fan by proxy.
Okay.
That's my fiance's team, so that's who I
That's who
support.
you are. Okay, so I'm safe then. Um,
Yeah.
all right, I want to thank both of you for coming through today. There's so many things to look at. On this issue, I was going to talk about the neglect of fake drugs and how it's everywhere in Africa. Shouldn't that be a global concern as well? But how much is being said about it? There's so many things. But like you said, this is just the first episode, and we will be delving into issues, breaking this down. And for every listener out there, do tune in every Tuesday from 11 to 12 p.m., 11 a.m. to 12 p.m. That is, to get clarity and better understanding on, well, global health. Thank you so much, Rachel Dunn and Professor Uche Ngwaba. Do enjoy the rest of
Thank
your
you very
day.
much.
And
Yes.
good morning to you once again.
Thank you. Good morning.
Morning, thank you.
All right, that has been a conversation we've had there with two panelists all the way from Canada joining us. It's 5 hours different, so it's almost 12 now, which means it's just about 7 a.m. over there, waking up to bring you information on health. Today in Global Health comes up every Tuesday.